Today on Diaspora Life Show, we discuss how Kenyans living in the US are dealing with the requirements from the state and federal government to isolate themselves and their families as the COVID-19 cases increase around the US. Welcome. And, this week and in the next few weeks, we're going to be talking about the big story that is happening around the world, and that's the coronavirus that has deeply affected and disrupted the lives of billions of people from around the world. In America, it's now just catching up. There's been this issue that in America we were slow to react to this virus, and also in compliance with the requirements that we keep 6 feet away from each other. We are going to be doing these interviews through satellite, and today, as we begin this week, I'm speaking to Professor Monda. Professor Monda is a Kenyan professor teaching in the city of New York. As it is right now, New York has become the epicenter for this virus, and so we want to get a sense of how New York City is with all this going on, and then generally we'll talk about what this means, the Kenyan community in the diaspora. We are the diaspora, so we have a very special show today. Professor Monda, please introduce yourself to our viewers and just tell us what you're working on right now. Give us a synopsis of what's happening in New York as we speak.
Yes, so I'm a professor at the City University of New York, York College, and I live in Manhattan, which is one of the boroughs of New York City. To be very honest, Chris, this coronavirus challenge has been unprecedented. I've never seen the city in the way it is right now. Many areas of the city are very much deserted, which are usually jam-packed with people. The rush hour period is usually extremely busy with lots and lots of people, millions of people traveling every day. Rush hour regularly now is very sparse. Most people are actually working remotely, and this has actually affected me personally because all my formerly face-to-face classes are now being done remotely, being done online and through distance learning. So also for faculty, it's been a major adjustment in terms of not being able to access the physical library spaces, for a lot of my students not being able to come to class, for faculty not being able to engage directly with students. So a lot of these have transitioned online, basically to mitigate against the effects of this coronavirus and its spread. It's really a major issue.
Professor, we've seen in the last 1 week, New York in the headlines. America is a big country. In fact, New York is maybe the fourth largest state in the union. We have union states like California, like Texas, like those are really big states. But in the last 1 week, New York has really taken the center stage in combating this virus. What would you attribute that to personally?
I think personally it's because of the unique nature not only of the state but also of the city. For example, when you compare a state like Texas or a state like California, these are large states, but geographically, spatially, they are very spread out. Dallas, Houston, San Antonio, or even if you think about Los Angeles, it's a very spread out cities over large geographical spaces. The challenge with New York City is it's literally an island, probably the size of Kiambu County, and you have over 12 million people within this very small space. So this really creates a major challenge when you're thinking about an issue like the coronavirus, because you have all these millions of people regularly getting into close body contact, rubbing up against each other. coughing around each other on the subway, on the trains, on the buses, in the public spaces, on the streets. And this is an extremely dangerous situation, not only for New York City, but given the fact that the regional economies are so integrated with other cities and other states like Connecticut, Rhode Island, Boston, Massachusetts, Wilmington, Delaware, Philadelphia, and Washington, D.C. So this virus can not only spread very quickly within New York City, but because so many New Yorkers and people from other cities around New York regularly come to New York and travel to Delaware, to Washington, D.C., Virginia, and Boston, this became a really drastic and major situation, and it's become a national crisis. And the epicenter right now, unfortunately, is New York and New York City, which has the largest number of cases as we speak, and Seattle, Washington State also following very closely.
Professor, but as you know, we have a large group of Kenyans living in the U.S. But even beyond the U.S., we have a large diaspora community spread around the world. Mm-hmm. One of the issues and one of the things that we've always said is that, you know, for Kenyans living abroad, it's a double tragedy because you just don't worry about your own self in your country of sojourn, but also at home. Whatever happens at home directly affects the diaspora. The diaspora still have very strong ties with the Kenya as it is. This place that unique place that the diaspora occupy, and the kind of angst, the kind of challenges, and the kinds of frustrations that are going through when they're dealing with these issues, especially the coronavirus.
So I think originally when the coronavirus started, the virus started, it was in Wuhan province in China. And that seemed a very distant kind of challenge with China and this country in Asia, Southeast Asia, that is important to the world economy, but it seemed a very distant problem. Over the last few months and weeks in particular, this disease has spread to many other countries. So to put your question in context, whereas initially this seemed to be a mainly Chinese problem, but it's really come to hit back home in New York City, but also in Africa, in South Africa, which has the highest number of cases, in Kenya, which is also pretty, has a lot of new cases. We had 8 new cases today, which brings our total up to 15. And it creates a double problem. I can speak personally on my perspective. I live in New York City with the highest number of infections, but I also have a lot of family in Kenya. I have my mom that lives in Nairobi, an elderly person, and I'm very much concerned. I have brothers and sisters in the city, cousins and relatives, and so this is a major concern also for me in terms of my concerns for how the virus is spreading, and also my concerns in terms of the health infrastructure in Kenya and the openness with this problem of the coronavirus. In terms of testing, is the testing really being effectively done? The capacity for testing, which is still low. New York City, we've tested over almost 70,000 people right now. In Kenya, those numbers are really, really low. And this is very challenging because we are also not quite sure of the extent of this problem. So it creates these dual problems, not only for me personally living in the diaspora, but also for family back home, and specifically with these challenges around testing and effective measures of controlling the virus, particularly for my family back home, but also for those underprivileged individuals in areas like Mukuru and Njenga, Mathare, Kibera, Bondeni in the coast, Kaloleni, Kisumu Ndogo, those informal settlements where a lot of the people just don't have basic health services and even simple things like disinfectants to clean their hands. So this is really a global challenge. So it affects me not only personally, but also affects my family, and it also is a big concern for me, for Kenyans in general, and for the continent.
A conversation on the coronavirus and the national census continues. And I invite my next guest. Alice, welcome to our show, Diaspora Live Show. Please introduce yourself to our viewers.
Yeah, thanks for having me, Chris. My name is Alice Alwatch. I live in Bayer, Delaware.
Alice, one of the things that we wanted to talk, one of the reasons why we wanted to talk to you today is because you have a family, you have young kids. Right now, families that have young children are mostly affected by the requirements that the people stay at home, the distance, self-distancing. How is it going for you so far?
Yeah, we've had to make a lot of changes at home, and I think honestly this is affecting a lot of Americans right now. I'm lucky to have the opportunity to work from home, but we've had our kids home for the last 2 weeks. So balancing between working from home and having little kids in the house, throughout, that has been very tricky. But then you have organizations that have also, gone out of their way to create leave, like COVID safety leave, that's also accommodating some of the employees. But again, as you might know, this is not the case all over the country. I mean, it's a tricky time right now.
That's very true. And, just following up on that, you work in public policy, you've worked with communities, you're involved in community work for quite some time, in the New County Council, for instance. But just talking generally about Kenyans abroad, as you know, we have different categories of people, Kenyans living away from home. We have those ones who have employment, who have an income. Then we have those ones who don't have an income, especially people who don't have the right papers, even just the legal status to live and work in America. Please just speak to the kind of frustrations that those groups are likely to experience differently.
Yeah, that's a good question, Chris. One, as you might be aware, there's just a lot of unemployment right now. There are people who are losing jobs. There are people who, between choosing to stay home with your kids, that means you get to lose 1 or 2 of your jobs. That means less income. That means people do not know where they're going to, how they're going to pay their next rent or their next mortgage. People are very unsure of their jobs right now, and it's becoming more expensive. Even when you think about the bills in America, it's crazy. Even for people who still have their jobs, it's quite a tricky time. There's a lot of uncertainty, not just even in our day-to-day living, but the fact that you don't know how long you're going to have that job. So there's just a lot of social anxiety that's going on right now, not knowing what's coming up next. But then normal, struggles, like you don't know if your income is going to be stable for a longer period of time. So there's just a lot of anxiety ongoing right now.
I was in Seattle, Washington recently, and one of the heartwarming stories that I came across is this young lady. She's Miss Kenya, USA. She lives in Seattle, but what she's doing is that she's using her crown to reach to the youth, to take part in the census, but also just to speak to them about the effects of the quarantine, for instance, because she says it's going to disproportionately affect young people. It's going to increase the rate of stress amongst our young people. We've noticed that even just before this happened. Please speak to those vulnerable communities, especially the young people, and what this is going to do to them, as you understand it.
Yeah, again, that's a good question too. Depression has obviously been quite a key issue in America, and especially with the young people. As I said, with just so much uncertainty going on right now, people are bound to be, and social distancing, so people are bound to be stuck in their homes. Folks who are in colleges have probably been sent home. We also have to think about international students who are not now in college. Probably some of them are confused on where they're supposed to go, and we don't even know. This is indefinitely, like we don't even know how long this is going to be ongoing. So there might obviously be an increase in terms of depression. People are now being stuck in their homes, do not have plans for what they're going to do, in the next couple of weeks or months. But talking from an advocacy and social worker point of view, I think one of the things just to remind ourselves is there are, like right now, a lot of organizations that are also trying to do like organizing work virtually. And so if you're like a young person, you're stuck at home, you've probably wanted to get involved, whether it's, in volunteering, advocacy work, or you're feeling hopeless. And you're trying to think, what can I do? There's just some different ways you can be able to contribute. I'm going to speak about like the bill that's just been introduced, the stimulus bill, and a lot of people are waiting for it. We hope, obviously people are in need, even financially, and we hope that's going to make a difference. But this is a time that if you're interested in doing like advocacy work, you want your voice to be heard, you can reach out to your members of Congress and speak up on issues like that from the comfort of your home. And be able to make a difference. The other thing that I also want to address with regards to what's going on now, especially on the global side, a lot of times when we have things like this ongoing, right, with the COVID-19, there's a lot of focus, and especially in terms of resources that are just primarily focused on COVID. And when we think about the global health perspective, and the milestones that we've been able to achieve from a global health perspective, this is actually the time when we're thinking about people like us who are immigrants and come from countries like Kenya. The steps we've been able to make ahead in terms of like malaria and TB and other things could actually really take a step back, because all the resources are being directed to that. So again, Congress plays a critical role, the US government plays a critical role. If you're a young person, you want to be involved in that, this is a time to, get connected and see if you can use your voice to speak up for your needs currently, either as a young person who's in college, as a young person who understands what it means to be homeless, or even as a young person who has an interest in what's happening globally. This is quite a time that you can get involved in advocacy work.
Awesome. Lastly, Alice, as you know, and you are involved in this, right now the census, the 2020 US census is going on. The government sent out letters, questionnaires to people. So people are supposed to fill them, even amidst all this COVID-19 and the disruption that has been brought about. Why do you think it's important for communities of color, specifically the Kenyan community, to take part in the census?
Yeah, so you alluded to something at the beginning and talked about, the fear of people without paperwork. And again, that is one of the things that usually holds people back. I remember even during the public charge when it was coming out, and there was a lot of fear that, people have, and a lot of miscommunication too. If you are maybe on your process towards either getting your green card, permanent residency, or even getting your citizenship, the government is going to take away those resources from you. And so we are constantly, as immigrants, surrounded by those kinds of fears. If I put in my information, what does that mean? Does that mean that I'll sit in my home and someone's going to knock at the front of my door and, take me because they've figured out either I don't have the right paperwork or all of those things. But I think at the end of the day, we need to understand the government needs to get the information of our population. If they don't know how many we are, they don't know how much, even when they're accounting for the federal budget, how much do they put towards funding that could be helpful to us. We are talking about Medicaid, we're talking about food stamps, we're talking about things that really affect us directly as immigrants, and again also a larger population of low-income earners that could really benefit from this government resources. And if we are not, and we have just to realize it's not that the government is trying to get our information and use it in a bad way. The government needs that information to allocate the right resources that we need and our kids need as well. So get out there and get counted.
Awesome. Lastly, Alice, as we wrap up this week's show on the census and also the COVID-19, what's your message to Kenyans around the world who find themselves in such a uncharted waters, so to speak, as people describe this unusually disruptive virus that has turned everybody's life upside down.
Yeah, these are unprecedented times. We are all anxious, we are all confused, we do not know what's coming, and so people are super worried. But stay home, stay calm, flatten the curve, and just, be considerate and responsible enough to make sure that you are not in any way, affecting other people by the choices that you're making to be exposed outside. Make sure that you're following the CDC guidelines. Listen to your local, federal officials, the rules that they're setting for your state, your communities, your cities. Follow them and keep everybody safe. I believe we're going to be able to get over this as soon as it can be done, and we can all get back to our lives.
Thank you for joining us today. We hope that you enjoyed the show. Remember, you can also share experiences. If you are a Kenyan living away from home, from wherever you are, you can send us a video, or you can write to us at DiasporaLifeShow at standardmedia.co.ke, and of course we are on Facebook. You can also inbox me on my Facebook page, and use your experiences in our next episode next week. See you again next week.